Center. And inshallah, our discussion or lecture today on health issues pertaining to Ramadan. Alhamdulillah, we have with us Dr. Imran Usmani. Dr. Imran graduated from Oxford University with a medical degree. Alhamdulillah, Allah Ta'ala blessed him further to complete his GP training in New Zealand. Came back, and I don't know how he done it, but he had a second degree in maths and physics. And furthermore, I don't know how he done this, he's doing a PhD in physics. Is that correct?
Mathematics.
Mathematics. Yeah. Difficult to comprehend, but mashallah, may Allah Ta'ala bless him. Alhamdulillah, Allah Ta'ala blessed him even more to be able to do a hifd of Quran. Alhamdulillah, the ijazah and the sanad to the Messenger of Allah Sallallahu Alaihi Wasallam. He's already done one event for us via Zoom and on health issues during the lockdown. And today, alhamdulillah, I'm going to pass the mic to our Dr. Imran to discuss health issues to Ramadan, especially those brothers and sisters who might be diabetic and so on. And inshallah, at the end, we can have a Q&A with the doctor, inshallah. Jazakumullah khair. Assalamu alaikum wa rahmatullah.
Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillahi nahmaduhu wa nasta'inuhu wa nastaghfiruhu wa nu'minu bihi wa natawakkalu alayhi. Amma ba'd. Alhamdulillah, Ramadan is fast approaching. I got a reminder the other day that Ramadan is approaching because a flyer came through my letterbox from Morrison's, the supermarket, and they were advertising their Ramadan offers on various food items. I also have a Tesco in my area, and they do the same thing. In Ramadan, they have special offers on rice and flour and dates and various food items. But I think this is something we should think about, really. We should reflect on this. That Ramadan is, of course, a month of fasting. It's a month in which we should try and reduce our consumption of food and restrain ourselves. But actually, we've made a reputation for ourselves such that even the non-Muslims, even the supermarkets, they know that in Ramadan, Muslims are going to buy more food. And so they try and capitalize on that by giving special offers. And actually, in my area, I live in Croydon, the halal butchers, they do the same thing. When Ramadan comes, they increase their prices. They know that Muslims are going to come, they're going to buy more meat, they're going to make more samosas and so on. And they want to capitalize on that. They want to make the profit. So we should think about this, that actually there's an Islamic ideal. There's an Islamic ideal, and then there is the way we practice Ramadan in terms of our cultural practices. And there is a bit of a gap here. You know, Ramadan is supposed to be a month of fasting, but for many Muslims it's a month of feasting, right? We abstain from food and drink during the daytime, but as soon as the sun goes down and the fasting ends, the feasting begins, right? Now, if you don't believe me on this, I want you to do an experiment this Ramadan. A very easy thing to do. What I want you to do is on the first day of Ramadan, I want you to weigh yourself and write it down, right, so that you get it accurately. And then at the end of Ramadan, weigh yourself again. Now, if your weight has reduced, then mashallah, you observed a month of fasting. But if your weight has gone up, you observed a month of feasting, right? And this is a very simple test that you can do to see where you are on that scale. So, alhamdulillah, I'm very honored to come here today and talk on this topic. Actually, I'm not a religious scholar, so I don't have as much religious knowledge as your Imam or many people here. So I may not be able to answer fiqh-related questions. But the reason I agreed to come and do this talk here today is because as a doctor, over the last few years, I've come to realize that actually medicine, modern medicine, has a lot in common with Islamic teachings. And it's not just superficial things where there is commonality. I mean, for example, doctors tell you not to smoke, not to drink alcohol. And of course, in Islam, that tells you also not to smoke and not to drink alcohol. It's not just things like this. There's actually a very deep connection between medicine and Islamic teachings, and I will explain this. And with this insight, I am actually very convinced that if, as a community, we followed the teachings of Islam and followed the example of the Prophet ﷺ, then as a community, our health would be significantly better than the non-Muslim community. But unfortunately, what we observe is the opposite, that the Muslim community has higher rates of diabetes, heart disease, kidney disease than the rest of the population. And this is actually very disappointing, and it's a very important concern, because it's not just about health. As I will explain, this is a spiritual concern, because the fact that we have higher rates of these diseases in our community, it's a sign that we're not following some important aspects of Islamic teaching. So that's what I would like to raise awareness of today. I don't find this topic being discussed very much in the Muslim community, and that's why I'm here today, inshallah, to try and raise awareness of this and hopefully to bring it to your attention. So I want to talk just a little bit about modern medicine and what modern medicine is like nowadays, because obviously non-medical people have their own views about medicine, and they get views of medicine from watching TV and things like this. It's not always accurate. So I'm sure everybody will agree that in the last couple of 100 years there has been a lot of progress in medicine. There have been some really big advances in medicine. We've come a long way. Now, if you ask the average person, what have been the greatest advances in medicine? What are the biggest steps of progress in medicine? A lot of people will say antibiotics or pharmaceuticals. Some people will say the discovery of general anesthesia, that led to the development of surgery as a discipline. Some people will say that it's technological advances in things like radiology. Nowadays you can do a CT scan or an MRI scan. You can see inside somebody's body. You can see their organs without opening them up. You can see their organs. And if they have disease in their body, you can detect it non-invasively. This is a huge advance. Now, these things are definitely big advances in medicine, but actually there's a really important advance that has taken place in the last 100 or 200 years, which has really changed medicine, and most people are not aware of it. And that advance has been epidemiology. Epidemiology is the study of disease at the level of populations. Don't worry, I will bring this back to the topic of Islam, but I just want to talk through this first. Epidemiology is the study of disease in populations. Now, this has really changed medicine in a big way. And it's changed it in many ways, but for the purposes of our discussion, the impact epidemiology has had on medicine is that now we understand the causes and risk factors for many diseases. And we know that if we mitigate those risk factors, then we can prevent disease from occurring. And prevention is better than cure. This is an adage in medicine. It's better if you don't get a disease in the first place, rather than you get the disease and then you receive treatment. Even if treatment is state of the art. Okay? So, for example, we're all familiar with the handling of the coronavirus pandemic. Why have we got all these measures in place? Lockdown and social distancing and mass vaccination. What is the purpose of all of this? It's to prevent people, especially vulnerable people, from getting the disease. Because if a vulnerable person gets coronavirus and they get sick with coronavirus, even if they receive the best medical care, CT scans and antibiotics and intensive care, there's still a chance that they might die. But if they don't get the disease at all, then they are better off. So this is prevention is better than cure. The aim of all these measures is to prevent the disease happening at all, prevent it in the first place. And this is just one example. Actually, there are many examples. Many of the commonest diseases that we have in our population today, heart disease, kidney disease, diabetes, all preventable diseases. If you mitigate the risk factors, if you avoid the risk factors for these diseases, then you can avoid them completely. So this is a really big change in the way that we practice medicine now, especially in general practice, which is my field, that the emphasis is different now. Hospital medicine is another field. Hospital medicine is practiced in a different way. They practice what I call reactive medicine. Someone gets sick, they go to hospital, and then the doctors in the hospital deal with that illness. But the damage is already done. The disease is already established. And then they have to try and do the best they can in that situation. But the emphasis in primary care and public health now is different. It's to stop people getting ill in the first place, or if they have a disease, detect it in the earliest stages and stop it from progressing. Now, this is a very challenging problem. This is very challenging to deal with because the approach is very different from the approach you would take in hospital practicing reactive medicine. In hospital, what happens? Someone is sick, they're desperate for help, and they will do whatever the doctor tells them to do. And usually the treatment that a patient receives in hospital is a one-off intervention. They need to take a course of medicine, or they need to undergo a surgical procedure or something like that. They do that, they have their treatment, they go home, hopefully. But with preventative medicine that I'm talking about, it's very different. Now, it's not a one-off intervention that is required. It is a lifestyle change. For example, the British Cardiovascular Society recommends that you get 20 to 30 minutes of exercise every day. Minimum 5 days a week. There's no use doing that for 2 weeks and then stopping. You're supposed to do that long term. Now, how can you do that? You have to bring it into your daily routine. You have to make a lifestyle change. That's what is expected of you. Similarly, why is it so difficult to tackle obesity? Obesity is very common. Why is it so difficult to tackle it? Because you have to make a lifestyle change. It's no use just going on a weight loss program for a few weeks. Because after that program, you might lose weight, but if you go back to your old habits afterwards, you will regain the weight. To maintain a healthy weight, you need to actually change your eating habits, you need to incorporate exercise into your daily routine, you need to change your lifestyle. And this is really difficult. To change someone's lifestyle is very difficult. And one of the reasons that it's so difficult is because we're competing against a consumer culture. This is the age that we live in. It's an age in which we have an extreme consumer culture. What do I mean by consumer culture? I mean that our lives, our societies, they are designed to give us the maximum comfort and enjoyment of this worldly life, which is completely un-Islamic, by the way, but that's the society that we live in. Everything is about having instant gratification. Let me give you some examples. Let's say you feel like eating Chinese food, or you feel like eating Italian food. What do? Pick up your phone, order it, 15 minutes it's at your doorstep. Let's say you want to travel from A to B. In the past, the only option for most people was to walk. They had no other option of travel. Now, you can jump in your car, travel comfortably in your cozy car. In terms of food, for many poor people in many countries, their staple diet is vegetables. But in this country, we have plentiful food available. You can eat whichever food you like, and you can eat as much of it as you like. Nobody's going to stop you. If you like meat, you can eat meat every day. You can eat it twice or 3 times a day. Eat it to your heart's content. It's almost like we're trying to create paradise on earth. Yeah? This is something we can look forward to, inshallah. If we all enter paradise, we can look forward to this in paradise. But this is not the way that Allah intends for us to live here in this world. This is the hadith is ad-dunya sijnul mu'min wa jannatul kafir. For the non-believer, yes, they want to maximize their enjoyment of the worldly life. But for the Muslim, it's different. For the believer, it's different. There are restrictions. We're told to hold back. So this is what modern medicine is competing with. You know, we're competing with this animal instinct that everybody has to seek reward, to seek gratification. If you present a person with chocolate cake on the one hand and turnips on the other, the majority of people will choose chocolate cake. Right? If you give a person the option that you can walk from this place to this place, or you can travel in a nice, comfortable car, majority of people will choose to travel in the car. This is classic reward-seeking animal behavior. People will always choose the comfortable option, the easy option. But what doctors are telling people is you can eat your chocolate cake and you can travel in your car and you can enjoy that short-term reward, but in the long term, this is going to damage your health. Doesn't this sound familiar? Isn't this what we say in Islam? That think about the consequences of your action in the hereafter. Don't think about the immediate consequences of that action. If you do something wrong, if you commit a sin, usually nothing happens. Allah doesn't strike you down with a bolt of lightning from the sky. Nothing happens. You don't notice anything. But it's our faith that there will be consequences later on. If not in this world, then definitely in the next world, there will be consequences to that action. And what Islam is telling us to do is look beyond the immediate gratification that you get from that action and think about the consequences of that action in the long term. And this is exactly what the doctors are saying. They're saying don't think about the here and now. Don't think about your enjoyment now. Think about long term, how this is going to affect your health. Now this is a very difficult challenge. Knowledge is not the problem here. Everybody knows smoking is bad for you. I challenge you to bring me a person who doesn't know that. Everybody knows that you should eat healthy food, that you should get regular exercise. Everybody knows that if you're overweight or obese, that puts you at risk of heart disease and cancer and so on. People know this already. Communication, knowledge is not the problem. The problem is implementation of the advice, because to implement this advice, we have to look long term. What are the long-term consequences? And we have to overcome the immediate gratification that you get from doing some things. Now, medicine is struggling with this. I will tell you honestly, medicine as a profession is struggling with this. And one of the reasons is because this is all new. This culture of consumerism is new. It's not been like this. Historically, it's not been like this. This is a unique problem to our time. The level of consumerism has reached an extreme level that is unprecedented in history. And that is having detrimental effects on people's health, and it's having detrimental effects on the planet. It's causing climate change, it's destroying biodiversity, and it's having detrimental effects on spiritual health as well. Because people are just being consumed by this culture of consumerism. And medicine is not equipped to deal with this because historically, medicine has never had to deal with this. Historically, medicine was always reactive. People got sick and the doctor attended to the patient. Doctors were not looking after healthy people. They were not spending their time with healthy people, telling them how they can prevent themselves from getting ill in the future, which is what I spend most of my time doing in my medical practice. I see people with symptoms and I have to diagnose them and treat them, but that's actually a small proportion of what I do. Most of my time, I'm giving people health advice on how to stay healthy, or if they have a chronic condition, how to prevent it from getting worse. So medicine doesn't have the tools to deal with this problem. And the tools that are being suggested, things like motivational interviewing and social prescribing, really, they're not very effective. On the other hand, Islam has been dealing with this from the beginning. Islam has many resources, many strategies by which people can attain control over their desires, by which people can exercise self-control. And what we need to try and do is we need to revive these elements of Islam and bring them into our practice. And I think this is really very vital at this time, because as I say, I think this culture of consumerism, it is having effects on many different aspects of life, and it's a unique problem to our time. There are many other problems too. There are conflicts in the world, wars, there's poverty, but these are not new problems. These have always been present throughout history. But the culture of consumerism and the effects that it's having, as I said, on health, on the planet, and so on, this is unique to our time. This is a spiritual challenge that we are facing in our time. And therefore, I think we need to revive elements of our religion that deal specifically with this. And one of those elements is, of course, Ramadan, fasting. This is designed to give you the upper hand on your desires, on your nafs, and help you to gain control over it. Now, I want these talks to be practical, right? So I don't just want to leave you with general advice that try in Ramadan to develop self-control. I want to give you some practical things to do, inshallah, in Ramadan. So I have 3 points that I would like everyone, inshallah, to make an effort to observe during this coming Ramadan. You can think of it as a kind of spiritual prescription, right? So point number 1, I think we should think about how we break fast. What I think you should do is when the fast ends, break your fast with a couple of dates and water, which is the sunnah of the Prophet ﷺ. Then don't eat anything else until after Maghrib. And pray your Maghrib, and inshallah pray your 2 sunnah and 2 nafil, and then sit down to eat. Now, why am I saying this? Why am I saying it? Because if you have fasted 16 hours or so, how long does it take to pray Maghrib and pray 2 sunnah and 2 nafil? Maybe 10 minutes or 15 minutes maximum. If you have fasted for 16 hours and you've exercised self-control and restraint, how difficult can it be to exercise that control for another 15 minutes? It shouldn't be difficult. If you can't do that, if you're in a hurry to go and eat, and in fact, what often happens, I want to ask the Imam Sahib this actually. What often happens is, in Ramadan, there's a bigger gap between the adhan of Maghrib and the Iqamah compared to the rest of the year. And as far as I'm aware, this is not based on hadith. There's no hadith that says in Ramadan you should have Iqamah later. It should be the same time interval as the rest of the year. Why is it different in Ramadan? It's different because we want to allow people want to eat. They want to satisfy their hunger first, then they want to pray. Now, what I'm saying is that if you're in that situation, that you can't wait 15 minutes, you're desperate to eat your food before Maghrib, or you pray your Maghrib and then you skip your Sunnah and Nafil and you quickly want to eat, I would argue that you haven't learned self-control in your fast. There's a hadith that some people, they gain nothing from fasting except hunger and thirst. You stayed hungry, you stayed thirsty the whole day, but you didn't learn self-control. Have you really gained anything from that fast? If, inshallah, you can break your fast with dates and water, pray your Maghrib, Sunnah and Nafil, and peacefully pray your Sunnah and Nafil, not in a hurry, then you sit down and you eat your meal, then alhamdulillah, I think you have learned self-control. And that self-control can then be applied in the rest of the year. So that's point number one. Point number two, inshallah, when you come to the masjid during Ramadan, try to walk to the masjid. Instead of driving to the masjid, try and walk. And this is not difficult. Actually, even if you live a mile away or mile and a half away, this is not a long distance. We think it's a long distance because we are in the habit of driving. But actually people for millennia have been walking these kinds of distances. The human body is very much designed to walk many, many miles. I'm sure you are aware that most of the people who did hijrah from Mecca to Medina did it on foot. People are very capable. That's more than 200 miles. The body is definitely capable of this, but people are not in the habit of it. But if you can develop this habit during Ramadan to walk to the masjid, then inshallah, even after Ramadan, you can continue doing this. And this is good for your health. It's also good for the environment as well. It reduces carbon emissions. It reduces congestion on the streets. It reduces disturbance to neighbors. Especially Taraweeh in Ramadan is quite late at night. People driving to the masjid, people are sleeping. Our neighbors are sleeping. It causes disturbance to them. It saves you money. The money you save on petrol, inshallah, give that money as sadaqah in Ramadan. There are many, many benefits to this. But the main thing that you will gain from it, inshallah, is it may change the way that you travel. If you can develop this habit of walking, then it can have a lasting effect after Ramadan. Now thirdly, and this should be easy if you do the first two things. Thirdly, I mentioned at the beginning, weigh yourself at the beginning of Ramadan. Okay? I think, I've thought about this. This is an achievable goal. Try to lose 5 kilograms in Ramadan. 5 kilograms. Now, 5 kilograms is not too modest, it's not too extreme. I think it's a good amount of weight that is very achievable. If you actually observed Ramadan very strictly, the way the Prophet ﷺ Sahaba did it, you could lose 10, 15 kilos even. But if you are careful, I think this is a very achievable goal, to lose 5 kilograms. And I realize, some people might be underweight. Obviously, it doesn't apply to them. But statistics tell me that 2/3 of the people I'm speaking to, it does apply. Make this a target. This is a practical thing. Obviously, do all the other things in Ramadan as well. But as far as health is concerned, I think these are 3 goals. which I think everybody, inshallah, make the intention, inshallah. Jazakumullah. I will stop there, and if there are questions, of course.
In terms of the types of food we eat, anything, any advice on that? Especially, the time of breaking fast.
So I think in the previous talk that I gave, I did talk a little bit about the types of food that you should eat. And I think, as I say, most people are aware that vegetables, fruit is an important part of a healthy diet. And fatty foods and sugary foods are not. Okay? So it doesn't mean that you can't eat them at all. I mean, if you're diabetic, you should really be careful about avoiding them. But if you're not diabetic, then you can from time to time have some such foods. But we shouldn't make a habit of this. And, particularly in Ramadan, people eat a lot of fried food, pakoras, samosas, things like this. We don't eat it the rest of the year. This is what I meant at the beginning by people tend to consume more in Ramadan compared to the rest of the year. We eat things that we don't eat the rest of the time. We reserve these things for Ramadan. Let's change our culture in that respect. There's actually no reason why we shouldn't eat vegetables, for our iftar meal. It's good food. And as I said, the whole point is to change habits. Because, like I said, to have good health, to avoid being sucked in by this consumer culture that we live in, we need lifestyle change. We need to change our habits. It's not just a case of doing something for a few days or even for a month and then go back to normal again. We actually need to make a sustained change. That's very difficult to achieve. It's not easy to achieve. But Ramadan, we can use it as a training ground. Because, as I said, during Ramadan, you have to fast completely from food and drink for 16 hours. You have to exercise a lot of control. But the thing is that control shouldn't just vanish as soon as iftar time comes. We should tap into that and extend it to the rest of the time. So this is why I mentioned the thing about walking to the masjid, for the same reason. Because develop a habit. Develop a habit, and then if you can develop that habit, in Ramadan it should be easy because the shayateen are chained up and Allah makes it easy for you. Then inshallah you can take those habits into the rest of the year. But I think, as I said, healthy foods, people generally are aware what's healthy and what's unhealthy. But the challenge is not knowledge. The challenge is to actually implement that advice.
Dr. Sir, look, I just want to, there's worry and concern with every family all over the world. It's only one thing, one agenda. The corona vaccine or something like that. And like we come from Sub-Sahara, we have lived with many diseases, malaria, everything. There's nothing done with it for the last 50 years I've been on the world now. And this virus just started 1 year. The time limit of it is something so, it's not wide. Because since I was a child, I know about malaria. Alhamdulillah, I'm 50 plus now, I'm still alive. I never encountered it. But this one that happened, we don't even know if it's real. They call it coronavirus, COVID-19, whatever they call it. The vaccine, is it real? Or is this something, sometimes when you are in the street, you say you're playing with your life, you're playing Russian roulette, gamble. Is this something dicey or something like that?
I think the virus is real, the vaccine is real. I think it's really, we live in a difficult time where there's a lot of misinformation. And everybody, even those who are propagating misinformation, they swear that they are telling you the truth. And it's creating a very big challenge now, because people have difficulty deciding what is real and what is not real. They don't know who to believe, who to trust. Now, I think one of the things that we need to do as a community, this is slightly off topic, I'm afraid, but one of the things we need to do as a community is Allah subhanahu wa ta'ala says in the Quran, إِن جَاءَكُمْ فَاسِقٌ بِنَبَإٍ فَتَبَيَّنُوا. If somebody comes to you with information, verify it. Because otherwise, if you act on that information, you can do harm to other people. So one of the things we have to be careful about is, a lot of this information, these kinds of theories that you're talking about, they're being spread on social media. And people are spreading that. You receive something on WhatsApp or Facebook and you notify other people of that without verifying it. And maybe the action that you are taking, فَتَبَيَّنُوا أَن تُصِيبُوا قَوْمًا بِجَهَالَةٍ فَتُصْبِحُوا عَلَى مَا فَعَلْتُمْ نَادِمِينَ. Verify it, because maybe if you act on that information, you might do other people harm. If you propagate that information, and because of your propagating of that information, someone who needs the vaccine doesn't take it, and maybe they die, then you are partially responsible for that. Legally, it's very difficult to make a case against you, but on the Day of Judgment, Allah is the absolute judge, right? Nothing can escape Him. Every tiny action that we do, we will be held to account for it. So we have to be really careful about propagating these theories, okay? We have to be, unless we have good reason to doubt solid information that is coming not from one source but from many sources, many governments, many medical organizations. We really need to scrutinize this kind of information, and my advice would be, please don't propagate these things. Don't have a hand in the spreading of this kind of information, because you don't know what is true and what is not true. So coronavirus is very real, and the vaccine is very real, it's very safe, and it is preventing cases. So this is the official truth, okay? People who doubt this, they doubt it because they doubt institutions. And really, I think we need to steer well clear of that. It's not a joke, this coronavirus. Many people have died from it. So, yeah, I mean, you're touching a sensitive issue here, because in my practice, I do come across patients who say similar things. And really, you need to think about the consequences of believing such things and the consequences of spreading such information. If it's your choice and you don't want to have the vaccine, that's up to you. You're only affecting your own health. But by spreading these things, you are affecting what other people do. So we should be careful about this. It's very much. I think a brother also has.
I was going to ask, but when it was about having diabetes and fasting, what are some good pointers that you should do, what you shouldn't do when fasting?
So most diabetics, they can fast,
Yeah.
okay? The only ones who need to be careful are the people who are taking medication that can lower blood sugar. So there are certain oral medications that can do that, like gliclazide, for example, and obviously people who are on insulin. So those people need to be careful because there's a risk of having a low blood sugar. The other thing you need to be careful about is hydration. Diabetics need to make sure that they have enough fluid, water, to drink in the night hours. It should be easier this year, inshallah, because I think it's shorter now than it was a few years ago. But that's important. You don't want to drink too much water, because what you will find if you do that is that you will just urinate all of it out in the first few hours of the fast. So you want to drink a moderate amount of water. Those are the two most important things. But if you're on glycoside and insulin, it doesn't mean that you can't fast. You just need to be very careful. And obviously, if you have a hypo, if you have a low blood sugar during the fast, then that is definitely grounds for breaking the fast. Is that okay?
Yeah, that's great.
Okay.
In terms of, I think it's connected to this question, what are the health conditions where a person should avoid fasting?
So every health condition, like for example diabetes, there are different degrees of severity. So there are mild cases and there are very severe cases. This applies to diabetes, it applies to heart disease, it applies to rheumatoid arthritis, it applies to asthma, everything. There's a spectrum. And most people with mild disease, they can fast. That's a general comment, but most people can manage. So there are some conditions, obviously, where we know that there are some conditions where you can't fast because the Quran says so. The Quran says, فَمَنْ كَانَ مِنْكُمْ مَرِيضًا أَوْ عَلَى سَفَرٍ فَعِدَّةٌ مِّنْ أَيَّامٍ أُخَرٍ. Whoever's sick, he doesn't need to fast. So that could be someone who's acutely unwell. For example, they're in hospital, they're having surgery, or they're very ill and they're admitted to hospital. You wouldn't expect that person to fast. But in terms of chronic conditions, most people with chronic conditions should be able to fast unless they have a very severe chronic condition, or unless it's vital that they take certain medications during the daytime. But in most chronic conditions, it's possible to work around it. You can take your medications in the night time and avoid having to take them during the day. So I think, if you will probably, those people who have chronic conditions, they will have a sense of how severe it is, and they will have a sense of whether they feel strong enough to fast. It might be that they can only fast one day and then they have to take a day's break and then do another one. But I think, try your best. If you're in doubt, the advice I usually give is don't ask a non-Muslim doctor, should I fast or not? Ask a Muslim doctor. Because if you ask a non-Muslim doctor, they will tell you no. Because they need to cover themselves, right? They don't want to be held accountable or held responsible. If something happens to you, then they will be held responsible. So a non-Muslim doctor, generally they will say don't fast. Even if you have a minor condition, they will say don't fast. Also, the non-Muslim doctors, the problem is that they don't see any upside to fasting, right? For them, you're taking an unnecessary risk. Why are you fasting in the first place? For them, it's not important. They're not Muslim. Why would they think it's important? So they will just say, why bother? Just don't fast. So what I would advise is that if you do have a chronic condition and you're concerned that you can't quite manage, then try to sit down with a Muslim doctor, one who is practicing, who prays 5 times a day, who observes Ramadan himself, so he understands the importance of fasting, and then ask them, should I fast or not? And then they can, inshallah, give you advice that balances your health condition along with the importance of fasting.
Say if you know someone who has multiple illnesses, even regarding with diabetes, to still fast or not? And the second question is, because I actively do running, should I still fast even though I'm doing the training for marathons, or should I avoid doing it? Because in terms of the long hours of Ramadan. And thirdly, because of your point where you said during the Morrison thing, there was I should tell you to go and watch the Samari Jannah video. They made a video on the Morrison Ramzan box. It's a total failure flop.
What was, sorry?
The Morrison Ramzan package.
Oh, okay.
they reviewed it. They said it's a failure.
Okay,
So
okay.
it's quite interesting one to watch. I recommend
Right.
everybody to watch that.
Yeah, yeah.
It's quite
So I think the first question was about someone with multiple conditions. Again, it's difficult to generalize because you could have heart disease, diabetes, hypertension, asthma, several different conditions, but they're all mild, okay? And so that doesn't necessarily stop you from fasting. And as I say, a lot of the medications, they're once daily medications and you can take them during the night time. You don't need to take them during the day. So you can change the timing of the doses and it can still work. So it really depends on a case-by-case basis. It depends on the severity of the conditions. It depends on how ill someone is. And so, you know, and generally patients have a sense of that themselves. They know if they are strong enough to fast. But in general, as I said, most people with chronic conditions should be able to fast. Those people who are acutely unwell in hospital, maybe not. But most people with chronic conditions should be able to. In terms of running, that's a very good question. I mean, I personally go running 3 times a week as well. And so I was considering the same thing. Should I keep that up in Ramadan? And what I was planning to do is to do it in the afternoon, right, shortly before the fast breaks. Because the thing with running is that you might get, especially if the weather is warmer, you might get dehydrated, you might start sweating. And really, if you're young and healthy, that shouldn't be an issue. You won't get so dehydrated that you need to break your fast. But you might choose to do it in the afternoons, closer to iftar time, so that then afterwards you can break your fast and drink some water. But really, that's the only thing I would be worried about is dehydration.
I just had one question. It's related to what you said about being Ramzan being the time to exercise a lot of self-restraint. I myself struggle with the amount of meat that I actually consume. So I think Ramzan is a very good opportunity to actually reduce the amount of meat that I consume. But also, you mentioned health benefits because obviously the more you reduce meat, the more it doesn't contribute towards cholesterol and high blood pressure. So is this something that you can sort of just maybe just raise that and just explain what how much meat should we be eating per week or per month?
I mean, my advice was once a week in a recent talk. My advice was once a week. Now, what I would, that's not based on hadith or anything, that's just like a recommendation. I think that's a moderate amount. Because Islam is a religion of moderation, right? I mean, it's different from Christianity, and you know, in Christianity, the Catholic Church, the priests, they're not allowed to marry even, right? It's extreme. In Islam, you're encouraged to marry. You don't commit zina, but you get married. So Islam is a moderate religion. It doesn't say no to things. It just says do them in moderate amounts. That's it. So the once a week is a kind of compromise, I think, between the habits of Muslims now and maybe where we should be. But what I would say about meat is that it's very much, and not just meat, but fried food and unhealthy foods in general. People eat these foods out of habit. It's not that we actually need them, but people do it out of habit. And you know, an example I would give is in France, as you probably know, they eat snails, right? We don't eat snails, right? In Japan, they eat a lot of seafood. They eat whale, for example, and sushi and things like this. They don't eat beef and chicken. which we eat a lot of beef and lamb and chicken in the Western world. But in Japan, they don't eat beef chicken. So basically, these different cultures, they have different types of diet, and a person just adapts to that diet. And actually, for a long time, I've been observing this: meat once a week and eating vegetables. And you develop a taste for it. You actually start to enjoy that food. If you eat it enough, you start to appreciate it. And even, mashallah, my children, they eat vegetables. I'm so proud of them. They eat it and they enjoy it. They really finish their plate, and they really like eating chana and dal and all these kinds of things. And so it's really just about habits. The body is a creature of habit. If you train your body a certain way, it will behave that way. There are many examples of this, Some people, they go to the toilet the same time every day. Yeah? They have a habit of going to the toilet at this time and this time and this time and this time. Because their body is trained that way. Even if they don't need to go, they still go because they're in the habit. If you move to a different country, you acclimatize to that country. So really, just about developing these habits, inshallah. And Ramadan is a good time to do it.
Oh, sorry, this one.
Jazakallah khair, brothers and sisters, inshallah, for attending the lecture. Special thanks to Dr. Imran Usmani, beneficial lecture. Masood, I think your question was about should you carry on running and not fast? You need to fast, maybe stop the running. And of course, I think about meat, fried food, very, very important. As Doctor mentioned in his previous lecture, he focused a lot on eating habits. And I think what is very, very important, we study the sunnah and the seerah of the person concerning eating. The food was very wholesome, it was organic, and meat was like a luxury which was connected to aqiqah, walima, Eid, qurbani, and those kind of things. Otherwise, they had a wholesome and also physical activity. The Prophet and the Sahaba were very healthy. So inshallah, a lot of points that for us to reflect on from what Dr. Imran mentioned. May Allah Ta'ala reward you with khair, Dr. Imran, and increase you in khair. Inshallah, write this lecture, a reminder of yours in your mizan of hasanat. May Allah Ta'ala reward all the brothers and sisters for attending. Assalamu alaikum wa rahmatullahi wa barakatuh.